Wash your hands thoroughly with soap and water beforehand and only handle one aligner at a time. Please make sure to rinse your new aligners prior to using them. Always inspect your aligners for cracks and deformation before placing them in your mouth. To help avoid confusion, each aligner is engraved with your unique case number, a U for the upper and an L for the lower, followed by the stage number. Gently push the aligners over your front teeth. Then apply equal pressure to the tops of your left and right back teeth until the aligner snaps into place. On one side of your mouth, use your fingertip on the inside of your back molar to slowly pull the aligner from your molars. Repeat this process on the other side of your mouth before trying to completely remove the aligner. Once the aligner is disengaged from your back teeth, you should be able to slowly work your way forward, gently prying the aligner away with your fingertips. Take care in removing your aligners and consult with your doctor if they are difficult to remove. Aligners should be rinsed, brushed, and dried prior to storage in a protective case. We recommend that you store your Invisalign aligners with mandibular advancement in the blue case. This will help protect them from loss and damage. Keep aligner cases clean by hand washing them with soap and water. Do not wash them in dishwashing machines. Please ensure to follow instructed guidelines and refer to instructions for use. If you have any difficulties, please consult your doctor.